how that particular bones are placed in between the joints, what are the different types of joints, etc., etc. Along with that, we have the organs and viscera. We remove out the organs and viscera from the cadavers like liver, heart, lungs, and we study like in piece, separated out. So that's how we are going to study this particular practical class or practical sessions or post lunch sessions. Now, this particular post lunch session that we are going to do, that consists of the prime anatomical learning. So, whatever the anatomy we learn, theory, practical, or whatever it is, we basically have the foundation roaming around that particular practical or dissection classes that we are doing in the post lunch class. So, no matter how theory we are learning, it is not consolidated unless until we are seeing that in dissections. So, this dissection class is the learning part which we are going to exercise. We have like a 1.5 to 2 hours of time. Sooner you come early over here and explore the cadavers, see the organs and viscera and study, and just like make small groups, learn here, taking up the books, taking up the notes out here. So, all the human bodies and this particular medicine practical are learned in these sessions, like the practical rooms. The medicine is learned in practical rooms, like in clinics likewise. So, this cadavers is going to be your first patient, as you can say. This is going to help you to learn this human bodies and etc., whatever things are there. In anatomy, largely confined to the normal anatomy, that means normal individual, normal ideal thing that we are going to see. We are not going to talk about the diseases, but of course, we are going to see the deviations of the normal, which might lead into some diseases. We are not going to talk about like this particular thing is there, discuss about the diseases. We should be knowing the names of the diseases which are related to it and the anatomy of that particular disease or procurement of the disease, that we should be knowing, or basic or foundation that we are going to emphasize. Now, this particular practical class will be tested in examination. After you are going having this, we will have the practical exams as well. Now, your practical exam, see for example 100% practical exam is there. Out of the 100%, 60% is based on your dissections and the things we are going to see in cadavers. So, we call them as 60% of the practicals of this particular thing that you are going to learn in post lunch sessions is going to be your cadavers. So, in cadaver you are going to get the exam questions, you are going to answer that questions based on whatever the things are there in cadavers. Rest we are left with 40%. 40% consists of the interviews. That means you will be crossed or you will be asked questions based on these particular organs, based on these particular visceras, which we call them as organs in anatomy, or osteology or the bones that we are going to learn over here. That we are going to learn some kind of radiological anatomy, we call them as X-ray, USG, or kind of special X-rays or CT and MRI, those kind of things. And as well as their part is anatomy, we call them as surface anatomy. That means in a deep to skin, we have some organ which is maybe bone, maybe organ, maybe like visceras, or maybe some kind of like a lines are there. We have to know that, we have to judge that through the skin. We call them as surface anatomy or topographical anatomy. So, for example, if you are going to say that like my right border of the heart, my left border of the heart, my right lower border of the lung, there is a salivary duct, we call them as like parotid duct. So, that particular landmark, how they are present over the skins, because as we are going to see in a clinical life, we cannot cut and see the things what is there. Like if the patient is coming to you having some kind of pain in abdomen or tummy pain, you say, "Oh, I sit down, I will cut, see and what is there, and then I will see what's wrong with you and treat it." It's not going to happen. So, you are going to see invisible things. So, based on invisible things, you have to make an intelligent case, which is going to help you out, like maybe your stomach is having trouble, or maybe your intestine is not going on, or maybe some organ you have to figure out or understanding this. So, this understanding is based on your anatomy. So, if you understand the anatomy of that human individual, which organ is placed where, and how this particular organ is troubling or coming with the pains and etc., that will help us to identify this. So, if you do not have normal proper anatomy, looking or examining the knee joint, you will be saying your heart is really bad and it is really hurting bad. So, you have to operate the heart out. So, say, डॉक्टर साहब मेरे तो ये नी है, ये कहाँ से बाद बाहर बाहर फेंक देंगे तो चलेंगे कैसे? नहीं नहीं, आपका हार्ट का इलाज होगा, इधर से ही हार्ट का इलाज होगा. So, you have to know that things, so whatever you are just like dealing with, so you should be, or you have to know the right and left side of this particular individual. So, if the patient may have this particular problem in the right side, you will operating on the left side and cleaning everything out. आपका छोड़ दिया, मैंने बात फेंक दिया, खराब था, बाएं तरफ का, लेकिन डॉक्टर समझे तो दाएं तरफ का किडनी का नहीं नहीं जो था मैंने खराब चीज. So, depending on things, anatomy knowledge, you can just like botch up things, or you can help out things, or you may complicate your life and your patient's life, your parents' life, family life, everything, or this is how these particular things are going to work. So, this foundation, if you have a good foundation on this, you will have things this. Now, this is the only subject that we are going to explore through. Whatever things you are seeing, you will be believing. In other practical sessions like physiology and this biochemistry, they are practically pretty much based on laboratories. We cannot see these things, how these chemical reactions is going on, how the sodium is binding with the chloride, or how this NaCl is forming, how this blood molecule is running. We cannot see that, right? Those are invisible things. But in anatomy, very much we have these things which is gross or naked eyes. If you see this, you believe this. If you not, you don't believe it. Like kind of things, right? Just like believing in something by judging, just like the science is. So, is the microanatomy. So, you say that we have a cell nucleus is there. You say where? And say, okay, I will show you in microanatomy. So, whatever we are saying it, we are going to see that, demonstrate that. So, this things is anatomy pretty much simple in a way. Whatever we say, there exist or not. There are no kind of things like which is not existent. But in reality, the diseases are not like this. It could be like something which may be there or may not be there. It kind of variable things. That's why we have to have an extensive anatomical knowledge, we have to have a physiology, biochemistry, everything is combining medicine knowledge together, and we have to have a radiological emphasis as well as X-rays, diagram, or any kind of ultrasound, MRI to substantiate, or blood test to just like justify. You are saying like this is an infection, it is showing in the blood picture. If you are saying this is an infection in lung, it's showing in the X-ray or CT scan or MRI. This is a problem is there. So, likewise these particular things are built on. So, whatever the things we are going to explore in anatomy, we will be seeing that, except this particular embryology we cannot show you in utero thing, because this is going on continuous process. We cannot just like cut out and see that, but we have sections of different phases of anatomical developmental region or embryological developmental of different parts of the heart or different parts of the body is there, but these things are beyond our scope of understanding at the undergraduate level. If you just like go on this particular embryogenesis or embryological study later on in higher classes or later on in research content, you can see that things, right? So, this is how we are going to see. Now, while we are going back to this particular practical classes, we going to do dissections or prosections. Ideally, it is prosections for the undergraduate because we do not have much time. So, we just like take cut out structures like we see this nerve, vessels, muscles, etc., and memorize and see the correlations or the content, how this is there, which is medial, lateral. You understand the medial, lateral, which is close to the midline, we call them as medial. Away from midline, we call them lateral. That means my arms are lateral, my nose is midline, so which is midline. So, in simple words. So, whatever things are we going to say like lateral and medial in terms of those particular references lines. If you say the high up like towards the head end, we call them as caudal or superior or it's cephalic. If you are just like going towards lower part, we call them as caudal, right? So, sometimes like we are just like going to address accordingly. So, as we progresses through, we will be getting used to the terms that we are going to say. Now, other than this, we have this particular contents as we are going to see these particular prosections which will be demonstrated, but sometimes we do the dissection as well to get an idea how these things are exposed, how these things are coming. So, if you get a chance, we will see phrase dissections afterwards, how these dissections are there and how these particular organs are taken out and identified accordingly. Now, we do not ask about the process like a dissection method or dissection ways, how we are going to do. we just like a focus on the end result, what is getting out of the dissections. So, for example, if we cut the skin, then deep to skin, muscle skin, etc., fascia, etc., we remove that and eventually find a structure or content deep sometimes in some parts of the body. So, we focus on the end result. So, what we are going to see this nerve, vessel, artery, muscles, etc., etc. So, those things we are emphasizing. We do not ask you how to do dissections, etc., etc. We do not ask you to demonstrate that in exam as well. So, we know that these things are beyond our scopes of learning. So, we just like to focus on prosection, that means dissected body which is present, and we identify the structures. And if you have time and scope, we will see the dissection as well. Now, if you are going to do the dissection, we need to have across some of the instruments, which are common instruments which you use that during the dissection. So, you have to have a familiarity with the instruments that you are using with. So, these are the instruments that we commonly use that. So, these are like the scalpel holder, and this is a blade or scalpel blade. So, these are having a particular shape. We take it out and it looks like this. So, this is a blade. It is a really sharp instrument. That is why I just like say that you cannot come here in the dissection class in uncovered foot. So, if it drops, you will get hurt, it will be cut. So, you cannot come here with open ended shoes or slippers or etc., etc. Now, this particular scalpel handle have a groove in here to fit in this particular scalpel blade, and then we just like put these things in together and these things are set. So, this instrument is ready for use afterwards, right. So, now this particular scalpel blade with the scalpel holder, we call them as knife. This is ready for dissection. This is the principal instrument to cut the skin, deep tissues, etc., etc., as we are going through doing the dissections. To assist this particular cutting element, we do need some instruments as well. This is a forceps. Now, this forceps is there and this is another forceps. So, these two forceps are having two kind of features. This one is, we call them as plain forceps, and this one we call them as toothed forceps. It has a groove in. So, it helps to grasp things. It helps to grasp things and it is not slipping away. So, if you are just like pulling things, it is not slipping away, rather it is having a tight grip, rather it rips off. So, to hold these things in a firm manner like skin or anything which is really tough structure, we grasp of course with this particular toothed forceps or with forceps with teeth. So, have a solid grip to it. Now, we are going to deal with some soft tissue structure, muscle, blood vessel, nerves, those are delicate structures. Those structures need to be held with this forceps, we call them as plain forceps. That means, it is not going to injure the organ. That is why we are going to use the plain forceps, but the adverse effect or disadvantage over here, it is going to be a loose grip. So, if you are just pulling it, it will be slipping away. So, that is what we want. We do not want to cram these particular organs between these particular lips. You can see that this is making a hole. So, this tooth forceps pinches through the skin and makes a hole. So, we do not want these things hole to be there within these organs, which is blood vessel, nerves, etc., etc. So, soft tissue are held by this plain forceps. So, whenever you are going to see these organs and structures, you should have two instruments with you all the time with your forceps pockets. One is this one, other is this one. Plain forceps and toothed forceps. Plain forceps are used for holding this particular organ, viscera, blood vessels, nerves, muscles, that means the delicate things, and the tough structures which is the skin, fascia or any kind of element that needs to have a tight grip, we have this toothed forceps for it. So, you use that together whenever we are going to do the dissections along with this scalpel and tissue forceps. Then, to cut this particular thing, we have nerve. These knives are of two types. One is, these are curved knives, right. So, it has a pointed or blunt end. This is a blunted curved knife. So, this is not sharp. So, some of the knives are straight and pointy. That means, we have two kinds of knives are there, either pointed or blunt like this, or the blade of this knife may be straight or it may be curved, depending on whatever we are using, depending on requirement, we use that curved or straight scissors to cut this, and as well as we may have this particular forceps which you are seeing here, maybe have a sharp pointed tip or maybe have a curved or blunt end to accommodate to cut the structures that we are going to do. Then we have this particular thing, looks like a scissor and has a catch, These are known as the tissue holders or tissue clamps. This can be used for holding like soft tissue, blood vessels, nerves, etc., etc. So these are known as tissue clamps or tissue forceps. It can be holding the tissues. That means within this you can have this. You may have a tight grip or may have a loose grip depending on whatever you are holding. Say for example, if I am holding a coil of intestine or a thick nerve, we can have it like catch it like this. So we are not putting pressure on it. So we are still holding but not pushing pressure on it, and we are catching it, we are closing it. That means it is locked with here. So you have to unlock it, then we have to release it. At the same time, if you want to have a tight grip on it, so we can use this particular tip over here and grab it accordingly and then catch it. So we can have the hollow viscera organs can be held it like this, or maybe we are holding, compressing this particular muscles, etc., etc. So if you are using this to grasping this particular blood vessels, we call them as forceps. Which you holding the arteries, we call them as artery forceps. If you are holding this particular thing for the tissues, which is only for the tissues, we call them as tissue forceps, right? Now these are kind of special thing because it relieves the pressure. That means if you are holding it, you do not have to press it. If you lock it, you can have it, left it over and do some other works. So your hands remains free with this catch or locks. So these locks, depending on how you are using, you lock and unlock it. So you catch it and let it go. It will not going to slip out. Then you have to unlock it and let it go. Likewise, we are going to use this particular instruments to do the dissections. Forceps, tissue forceps, artery forceps, or kind of visceral organs to cut this, knife, blades. These are the common instruments for you guys. I want you to just like have these instruments, forceps with you all the times whenever you are going for dissections. It may be just like a long, maybe just like a short forceps, doesn't matter, but you should have this for your examination and as well as doing the dissection things. Now other than this, we need some cutting instrument for organ removal, etc., etc. Say for example, we have to remove this brain, we use the saws. So we cut this particular like skull and remove the cavity, remove the cap of the skull and then take this organ out. We can use this particular saws. We can use this particular saw for cutting through the joints as well if you have to. This is known as this particular cutters, or it can be used for cutting bones. These are really sharp and have got like a really powerful elements. So these are can be used for cutting like bones and kind of like elements or joints or capsules or something ligaments which are tough. You can use this particular element to cut it. These are hammers, and we have a chisel, like a chisel kind of thing, which looks like a this one has a like a wooden bar which is little bit swollen like this. So use that to hammering that. So the chisel and hammer used to break the skull to take the brain out. This instrument we call them as brain knife. So this one we use to cut the brain. So this brain tissue, if you are going to cut this, we use this kind of knife. We call them as brain knife. So this kind of knife is not very sharp. You can see that this is not a sharp instrument. Rather, it has a very much weight is placed on it. So this weight is on this upper side. So with this weight, if you just like put it, this particular brain element, being a soft tissue structures, splits through and we can get a sections of the brain cutting through this particular brain knife instruments. So these are the common instruments that we will be using doing the dissection. These are the trays or instrument trays. Along with that, we have the tapes, we have the knife, we have these threads, we have some kind of pointers are there. We will be using this for identifying, holding, pointing some of the organs during the dissections. So during the dissection time, you just whenever you get a chance, whoever is going home or getting a chance out here, you get this kind of two of the tissue forceps. One is this plain forceps and one is this particular toothed forceps. The plain forceps, you will be using that forever, like in your clinical life as well. Plain forceps, you will be using that for your clinical examination part as well. You require that. Along with that, we have the physiology instruments there, like the stethoscope, the blood pressure measuring machines, the hammers, etc., etc., ophthalmoscopes, etc., etc. Those are the physiological instruments that we will be just like slowly procuring. These are the common instruments that we are going to use. So, next day onwards we will be starting with this particular like bones, soft tissue structure, viscera, etc., etc. Then all these particular elements, if it is covered, then we will go for the dissection part, which we will be going to do the dissection or prosection through the cadavers. Some of the prosections may be there already, and if you have time, if you have enough cadaver left with us, then we will be doing this particular dissection as well. All right. So, this is the dissection hall that we will be using. These are the wash machine that we will be using. You should be bringing that some of your like a papers, soap papers. You know the soap papers. You keep that soap papers with you, because now many times we see that these particular the soaps are running empty. So, in that case, you have a backup soap papers with you. You bring the gloves. So, check your glove size, like a medium size or small size, whatever size you are having. You keep this particular glove size. Use double gloves whenever you are using this particular like a dissections. Yeah, single gloves is good enough for doing this particular like normal examinations. So, examination gloves, latex with powder or without powder is good for you. You do not have to buy the surgical gloves. And these two instruments that we will be bringing, if you are having some kind of allergies to this particular like flesh, or allergic to these particular smells of the like formalins, you may use this mask, or you can use the eye goggles if you are allergic to it. And it will going to be like little bit nauseatic in the beginning. Later on it will be okay with the smells of the formalin, etc., etc. And always use the cover shoes whenever you are coming, because the chemicals will be there, it will be spilling over. And as well as this particular element have got like a sharp instruments. So, if by accident it falls, it will be a big mess. And during dissection is going to be a little bit crowded. So, people stand on the stools. I would recommend not to do that, because you fall from the stools and break your legs and go home for 2 months, 6 months, forever, right? It happens, right? All the time it happens, like people fall off these particular stools and you go to hospital with the cracked bones and come back after 6 months when the course is done. So, better be careful with this. Use this kind of like ventilated croc shoes. These are good for like dissection shoes, right? These are Swedish nurses shoes, now is used as croc shoes. So, these are the good for the like these are cover shoes, good cover shoes. They are kind of like used, washable. If you, even if you are just like using this particular like falling with the chemicals, easy to wash, right? And easy to maintain as well. So, this is all how we are going to begin with this anatomy dissection. Remember that 60% of things will be on cadaver. That means out of 200, 60 marks will be on cadavers. So, your pass and fail depends on the cadavers. If you pass on the cadavers, you pass, or else it's fail, right? And even after 60%, 20% after that will be on cadaver instrument, cadaver element like bones and visceras, etc., will be there. So, next day onwards we will be starting with the bones osteology. Tomorrow we will have a lecture on the osteology classes. We will be just like have a brief introductions of the bones, and we will emphasize where to study the bones, or which part of the bones we will be studying as general, and later on we will be learning and studying individual bones, right? Go for the textbook, as I mentioned, find one textbook which suits you, which do not have a lot of explanations, like very small written book, but find a book, right? Not much of like you do not have to know the length, only you have to know the depth, right? So, you do not have to know vast things, rather things which is having some 3 lines at least on a content you should be knowing. That will help you to memorize things and build on things. Later on, as the things will be go, if you go for vast, you will lost. You will be lost for the with the stream of vastness. So, it will be going for depths rather than vastness. I be saying you it's a good book, or BD Jourashia book. You can go on the library, check the books, whichever you feel like good one, feels with your tone, like which you find good enough. I find some book is useful for me. Some book you are like liking with it. So, you have an individualized like preferences, likings. So, go for your individual books, but do not choose any book which is too heavy in content. So, go in the book which is easy on content and not too much of explanations is there. So, thus stating the anatomical fact based on clinical emphasize on it. So, that has a clinical things which is tagged or related to it. So, we call them as clinical anatomy nowadays. So, most of the questions will be set on clinical anatomy, which is based on gross anatomy foundation. So, if you are just going to ask you about any questions, we are going to ask about the gross anatomy twisting through the clinical scenario. So, we are going to ask you about like a myocardial infarctions or heart attack scenario with anatomy of the heart. We are not going to talk about like tell me about the myocardial infarctions, rather the clinical case of the myocardial infarctions with the anatomy of the blood vessel or anatomy of the blood vessel supply to the heart, etc., etc. Likewise. So, as we progress, we will see that and get 5 years or last 10 years question from the universities, which is available in different kinds of like websites or any kind of like PDF are available. So, get across these particular questions, how the questions are being given in the practical and as well in the theory. So, you will get to know that how the clinical question means to us, right. So, then it will be easier for you to grasp hold on the contents. So, this is all. So, till we have this particular dissection class next week, probably we will be starting with. So, meanwhile, you find an apron or any kind of like instruments which is required for this, and cover shoes and mask and gloves, whatever things are required for you. Come with short note, like every day come with a short notebook with pen, that is it. Like you can bring bottles of water if you want to have water in between, but just like do not bring too much of contents, right. And mobiles and things you leave at, better you leave at home or leave it here, alright. So, try to listen the things not through cameras. All right.